Do you guys think sales is important in dentistry?
So important.
So important.
Well, I don't want to call it the word sale.
It's a bit of a dirty word.
Knowing how to sell.
Knowing how to sell. Have you done anything to learn how to sell, especially in a dental context?
Here's the thing, Mohammed. Oh, you say you don't like that word, but how many times the way you word things, how many times was there the possibility that it could lead to a complaint, for example? Or sometimes we say things and it makes the patient more anxious or puts the patient off. So it's really important that you know how to say things in the correct way to make the patient at ease, to give the understanding, but also to portray what you want.
I don't think it's a dirty word. The reason I say that is we sell on a day-to-day basis. Even something like convincing somebody to improve the oral health. Who do you think is more likely to motivate a patient to brush twice a day, use the floss? Somebody who's persuasive, got good sales skills, or somebody who's not so confident in what they're saying. I think it's in the patient's best interest to have sales skills. I know it's a dirty word and it's seen in the wrong way, especially in a healthcare perspective. And obviously we have to be ethical about it. But I realized in foundation year that the way you speak, the rapport you build with your patients makes such a big difference. And it's not necessarily, I don't think we should measure in terms of how many Invisalign cases have I got or whatever. I don't care if the patient does it or not or what treatment it is. It's simply being able to convey something to a patient in a way that motivates them or in a way that just helps them understand what's possible for them. I think that's big in itself. And a lot of people are too scared to talk about things like teeth straightening, or let's say you've got multiple defective amalgams and you want to replace them for onlays. These sort of things, a lot of people are worried to mention them because it might come across as salesy. But I think we still have a duty to mention these things. By the way, you can align the teeth using these products because it's going to give you better hygiene. It's going to help with the bite. Long term, it might help. That is an element of sales, but in an ethical way. And I kind of realized that when I was in foundation year, that's important, and started to really focus on that in the sense of just being able to speak better with patients. It makes all the difference. And similar to what you were saying, Marwan, is in terms of complaints and these sort of things, if you can build a better rapport with your patient, have a better relationship, dentistry becomes so much easier, and you get to do the work that you enjoy. You get to do the work that's best for your patient because the patient's quite motivated to do it now because you've explained it in the right way. You've explained it honestly and truthfully, but in the right way.
So sometimes I feel like when you don't sell, it can actually lead to complaints. So I had a patient once. It was a different dentist patient, and they came to me, and I think I offered Invisalign or private consult. I don't remember what I offered exactly. But then they told me, why was I never offered this before?
Yeah.
Why was this option never given to me before? But it's because that dentist wanted to stick to classic NHS dentistry and not offer private options, not selling to them.